This is called a hip controlled articular rotation, or CAR. I'll demo the movement first, then break it down into the component phases for you to learn. So, essentially the movement is a circle with the hip, but it has phases that are required so that you can start unlocking your hip. Be sure to download the PDF handout that goes along with these phases. So to start the movement, you'll need to take balance out of the equation. In order to do this, you'll need to be either by a wall, or if you have a stick, you can grab hold of the stick to use that. If you really can't stand on one leg at all, you can do this on your side, laying on your side, but the movement might change just a tiny bit, but it's okay, you'll get the concepts from it. So to start phase one, what you're going to need to do is move that hip inwards, and then you're going to externally rotate that hip, or moving that hip out to the outside. As you move that hip to the outside, the foot is going to start to come up. That's phase one. Phase two, you're going to start to move that hip up towards your chest into hip flexion. From there, phase three, you're going to move that hip out to the side, hip abduction. Then phase four, you're going to internally rotate that hip, or think of trying to move that hip down and rotate it down to the ground. As you do that, the foot is going to come up towards the back side. Phase five is you're now going to move back into hip extension. Move the hip all the way backwards until you end down by your side. From there, we'll just retrace the movement back to finish the whole movement. So we'll go backwards, out to the side. From here, we're going to rotate it back the other way, hip external rotation. Bring it all the way to the start and cross that midline. So I'm going to show you what it would look like from a side view. So phase one goes across, externally rotates. Then from there, phase two, hip flexion. Phase three, out to the side. Phase four, internally rotates. Phase five, extension all the way back, down by the other leg. Then we'll return that motion all the way back to the start. So here are some common issues that you might encounter during your practice. Remember, this is a hip drill, and we're practicing how to move the hip independently, and so we're not trying to have compensations from all the other parts helping it out. So with phase one, what you might experience is that as you're moving the leg across, you're going to go too far with that hip. Second part is that as you're trying to get into hip external rotation, moving the hip outwards, you're going to experience motion from the knee itself going into tibial motion instead of simulating what the hip should be doing, is going outwards. As we go into phase two, we're going up into hip flexion. If we don't have enough of this hip flexion, our spine is going to help us with that motion. So it's going to want to flex down this way instead to help us clear some of that motion. Or if we can't get here and we're starting to get even more, we're going to have our pelvis tuck underneath us here, which will also simulate more of that spine movement that we're not looking for. Going into phase three, once we're in this position, we're moving it out to the outside. If we kept going too far, our other hip is now going to start to swivel with it, and that's going to be a compensation that we don't want to have. Then from there, stage 3 to 4, if we don't have enough internal rotation of the hip, what you'll see is that the leg will have to drop down to get you even that clearance so you can get the heel up. Or if it doesn't drop down, you're going to start to experience a need to move out to the side to get a little bit more of that motion, or even the hip might start to hike up towards here to get you some of that clearance. Moving to stage 5, that hip extension as we move it straight back behind us. If we don't have enough that hip range, we're just going to keep going back and try to get as much motion from that lumbar spine instead, and that's not what we want either. So those are the common compensations and issues that we're going to experience during the hip CAR position. So how do we address this? One way is a concept called irradiation, where we squeeze tension into our body from other parts like your hand to help create more force while we concentrate on moving just the part of the hip we're focusing on, slowly and controlled. So what does this look like in practice? So you can take your hand, squeeze it out to the side. You're going to irradiate tension from that hand into the rest of your body. If you're holding onto a stick, you can also squeeze that stick, slam it into the ground. Or if you're holding onto the wall, you can push against that wall, but just make sure that you're not pushing yourself over, right? Then you're going to concentrate on moving through those phases nice and slowly, concentrating on the area that you're supposed to be moving through. and then just continue to create tension all throughout the rest of your body as you're moving through these phases, so that you can create just that movement into the hip that you're looking for. This will not only create strength into those areas that we're working, but also will help you teach how to move that body a little bit more efficiently, so that it can help carry over into everything else you're doing.